What's up, everybody? This is Dr. Nick with Leverage Media, and welcome to another special episode of the Path to a Million podcast. I am here with a good friend of mine, Dr. Jami West. Dr. Jami, say hello to the people.
Hey.
So Jami and I have known each other for a few years now, and she has been crushing it in the virtual functional medicine space. And so I wanted to bring her on because there's a lot of nervousness, panic, different stages of all of that out there on what will happen if I close. And so I wanted to bring Jami on because she's been doing the online virtual side of things for a little over a year now. She still has her brick and mortar, and I just think that she's really great at what she does. So I thought I would bring her on. So Jami, tell people a little bit about yourself, where you practice, what you've been doing in the virtual space, and we'll get started.
So I practice about an hour north of Dallas, Texas, on the Texas-Oklahoma border, where I grew up. And I obviously am trained as a chiropractor. Haven't practiced chiropractic full-time in about maybe 4 years since I brought associates in. When I was pregnant with my third child in 2018, I decided that I don't want to ever go back full time, and I have a lot of people seek me out for functional medicine, and I need to be able to take this where I can stay at home with him as long as I want. Now we're on to baby number 4, so now there's an even bigger need for that. Right. I haven't adjusted since September of 19 due to an injury, so this has really allowed me to create more of a program even for doctors that want to learn this, because I've been asked by multiple to do that. So yep. It's kind of given me that to improve the process for patients as well as for doctors to learn how to do it on their own.
Yeah. So that I definitely want to go into like the details of the program that you've been kind of developing it, but now it's like, I told you, I was just like, you got to get this out now because people need it. But I want to make sure, because that's a program really for like how to do functional medicine, how to read labs, and also how to do the virtual side of it. But for the majority of this, I want to talk to just kind of put your chiropractic hat on and think through, if you didn't have the virtual, if you didn't know anything about functional medicine, how you would be utilizing what you know about virtual. I keep wanting to say telemedicine. I just hate that word, but the virtual practice, what would you do for the virtual practice if you had to shut down? So just for some context, Kentucky yesterday, I think there's some kind of back and forth on whether like the governor didn't really say it, but the board said they had to shut down. So a lot of people in Kentucky decided to shut down. Illinois today put a stay at home order. So even if you don't like technically have to shut your doors, I would guess that the vast majority of patients are probably going to stay home and wait for the 2 weeks are up or however long they're doing it for. So let's just assume that this is coming for your state, because I think eventually they're going to have to do a nationwide lockdown, just because it doesn't make sense for like Illinois to do it, but not Indiana. It's just kind of weird. So anyway, so let's talk about those general chiropractors out there. Explain to me how exactly well, first of all, what would you be doing if all you had was your practice? You just saw a patient, you just adjusted. What would you be doing on the virtual side, starting today?
I think webinars are huge, just for general information and for keeping kind of your face out there to your patients and the people that aren't your patients yet. Yep. In Texas, we can't say that an adjustment boosts the immune system, but you can do things to support the immune system as long as you don't say an adjustment's part of that. So lots of tips on nutrition, things that you shouldn't be eating. No sugar, no processed foods. You can find fruits and vegetables at the grocery stores, but you can't find processed food. So, who's going to get sick? But pushing that out to patients, what parents can do for their kids at home, kind of to boost immunity, like what supplements are good to take. So we sell a lot of supplements in our office every month, and which ones are best. So pushing probiotics and the importance of that, and D and the importance of that, and multivitamins. Most people don't get the nutrition that they should, so everyone needs to be taking that. And that's going to help your kind of back end sales, but also have a place to push them to where they can buy it and you can benefit from it.
Yeah.
I don't do a lot of this, but my associate does, as far as like rehab and exercise and things like that. You can show patients how to do that at home and push it out, whether it's in an e-blast or you use 𝗪𝗡 to send the videos, or you do it as Facebook Live or webinar or however, just to make sure that while they're home, they're still moving and they're not going downhill and sitting in a chair all day.
For sure. For sure. And, I like the idea of webinars to kind of create a big net, and that gets a lot of people in that are just like interested in the information. And then, it's just like anything else. You give out some valuable information, but if they want one-on-one time, that's where the virtual practice can start to come into play. Because when they see you as an expert right now, I think people are just hungry for real information that they can be proactive with instead of just being scared. So if they see you as an opportunity to do something that they have control over, I think that's probably the biggest thing, is people are just looking for a little bit more control in their life. And if you give them a way to have more control over them and their families' lives, I think they would appreciate that. So, so let's talk about technically how to do it. What are some of the softwares, tools, what do you recommend?
So I use Zoom. There's a healthcare Zoom that's HIPAA compliant. I think something came out about Medicare, with them not worrying about it being HIPAA compliant, but that's what I've always used, is Zoom. Is
it a special Zoom package for that?
Yeah.
Okay. So if you type in healthcare Zoom, you'll be able to find it.
Yeah.
How much is that a month?
I paid $200.
Okay.
The basic one's like $149 a year or something like that.
$149 a year?
The healthcare is $200 a year. I'm sorry.
Oh, okay. I thought you meant $200 a month. Oh, that's like no brainer.
Right. Yeah. So super easy, not a huge difference from the regular.
Yeah.
If you're doing Zoom, also you have to have a coaching document or something so that the patient understands that they're being treated through telemedicine. Just like a consent to treat, like you do in your office, but just for virtual. So super easy.
What would they have to change on the one that they have now?
Just saying that you understand that your treatment is being rendered through virtual telemedicine or through telemedicine.
I got you.
There's a ton of those out there.
Okay.
I just send it before every patient.
So again, just Google telemedicine consent form. Got it. Okay.
And that's just covering yourself. As far as coding, I do all cash. I know that insurance companies are changing things day by day to allow this. So if you do,
real quick, just before I forget this, if somebody wanted a copy of yours, could they email you for it and you could email them? Okay.
Yeah.
Okay. What's your email?
Dr. Dr. Jami West, JamiWest @gmail.
Okay, perfect. Got it. Okay, go ahead.
So insurance companies are changing their coding laws as far as what they're allowing for telemedicine. Before there weren't really any, maybe 3. I bill all cash though. So just kind of watch that too.
What have you, you're saying that because of all of this, insurance companies may be opening that up and maybe creating codes for that?
They are creating codes. Yeah.
Gotcha. Okay. Where where are you hearing that? Where would somebody find out more about that?
𝗪𝗲𝗀𝗀, the HIPAA compliant, he's a chiropractor too, but that's who is coming out with it. And then I'm on a Texas Chiropractic Facebook page. So
okay. Yeah.
But you can Google
all this stuff would be state by state, I would imagine.
Right. And it's all brand new. So
yeah.
And insurance company dependent. So
okay. All right. All right. So we've got the consent form, we've got the HIPAA Zoom. I assume for payments, you could just use whatever credit card processing company you're using now.
I use Stripe. I like it a lot because you can personalize everything. Obviously, PayPal's an option. If you use Cash Practice, which we do in the office, they have a link you can send out to the person. We do that before they schedule appointments.
Yeah. And I think Fortis does I know Fortis does as well. And I would imagine that ClearGauge and, all the major credit card processing companies, if you ask them, they probably have a way to where they can create a payment page for you. And what I tell people to do with the Cash Practice and Fortis, because we know how to do that, is you have to set the price so that people can't type in $6,
right.
14. It's just $49 or whatever the amount is. just be sure that you can set that price on the online form.
Yeah.
All right. Is there anything else so if you have the HIPAA Zoom, I would imagine you could run webinars through that as well, right? Do you know how many, like for me, for my Zoom account, I can do up to 100 people per webinar. Do you know how many come on or is it like an add-on?
It's an add-on. I want to say it's 40 a month. I don't know the limit. I want to say it's 100, but I want to say also you can go to like unlimited or 5,000 or something kind of crazy too.
I think that's probably what it is that the webinar 100, it's a package with Zoom that's just like a $40 add-on to whatever your base package is. So if you have the HIPAA Zoom and it's $200 a year, then it would just be basically like $700 a year total. To be able to do webinars. So for the webinars, you can do those through Zoom as well. And then you'll have your own private meeting room. Like right now we're on a webinar. So I could have people on this webinar if I gave out the link. And the way that like basically Jami is a panelist, she was in the audience of the webinar. I was able to like elevate her to a panelist. So now we can both be talking. So you can do that. You could do the webinar, and if somebody raises their hand or if they type in a question, you can actually bring them up as a panelist so that you can do a video chat as long as they have video like this. But anyway.
And the webinar package you can do month by month. So if you know, like things are better, I don't want to do webinars anymore, you can cancel it where you're not like stuck with that for a year.
No, perfect. Yeah. All right. So anything else in terms of the technical side of things?
State laws. So you have to look at your state laws. I think you have to contact like Health and Human Services or look it up and see like, can I treat or help someone in another state? So take that into consideration too, if you're planning on doing that, and then make sure that you document. So patient was consulted via a Zoom call or telemedicine or however you want to word that. And then you have to document just like you normally would.
Okay. Is there anything else in terms of things they need to look out for, worry about, I's dotted, T's crossed kind of stuff?
Biggest thing is that consent and your documentation.
Okay. And I would imagine getting the requirement to be, or whatever you have to do to be able to talk to somebody outside of your state.
Right. Yeah.
Right.
Just check that.
And you said to talk to Health and Human Services, like the federal agency?
Like the state agency.
Oh, the state agency. Okay.
Yeah.
So whatever your Health and Human Services, because it may not be called Health and Human Services in every state. So
right, you can Google like Texas telemedicine laws, or like say you like I have a patient in Georgia, so Georgia telemedicine laws, and it'll tell if a provider, because everybody's state licensed, and consent or treat someone in a different state.
So let's use that for an example. You're in Texas, the person's in Georgia. Do you have to call Georgia? And
I just look online with Georgia. Okay. Yeah.
And like, what are some examples of like other state laws that you've seen? Like, have you had to do anything for those people out of the
state? Haven't yet. I have patients in probably like 6 or 8 different states, and I haven't ran into anything yet.
Okay. So you haven't had to do anything extra yet. You've only had to like focus on the stuff in Texas.
Yeah.
Got it. Okay. But know your own state laws and also know the state rules in wherever the patient's at.
Right.
That's the other nice part is that, if you help one of your patients out and their mom lives in Georgia and you're in Texas, it's like now you can even expand, your patient base. So that's a good thing.
And that's what you hear a lot. Like, well, I wish that you were in so-and-so, my daughter lives there. And I'm like, well, actually, we can make that happen. Yeah. Then you're not having to, worry about who do I send them to? Are they going to have the same treatment guidelines I do? Are they going to have the same beliefs? Are they going to tell them like, go get your vitamins at Walmart and, I'll see you next year.
Absolutely. Right. So how do you charge for it? What's the pricing structure that you use?
So on the way I am with patients virtually is I charge $197 for what I call a discovery call. I used to do it for free. 15 minutes to make sure kind of they know my guidelines and what I expect to make sure we're a good fit, because I don't want to take everyone on and then they be disappointed, I be disappointed because, I expect these things, but they're not willing to do them.
Yeah.
And then I charge labs altogether as a package plus my consult fee. And then they pay me, I pay the labs. Then when we go over them, that's when I present a package to them. And it's based on what they need. I don't do the same thing for everyone.
Right.
Usually we start with 3-month minimum. We go up to 6 months.
Gotcha. Right now, do you think that people would be able to go out and get labs? Like, do you think they could still, it wouldn't be a problem?
I would think so.
Okay. Yeah. Cause as long as they could get blood draws, I would imagine that they can still get it to like LabCorp or Quest or wherever.
And they even have mobile phlebotomy, like where they come to your house.
Gotcha. So, okay. Yeah, I think things might get a little bit iffy here in the short term, but long term, I definitely think that like it's so simple now to be able to get that stuff done.
Oh yeah.
If you weren't going to be reading, like, let's say somebody needs to like get something going like in the next week or two, to like maintain some type of income, and they don't really know how to read labs right now. You know, what would you be thinking about, other than just like general advice, or is that pretty much it? Just like nutritional stuff, supplementation?
Yeah. I mean, if they don't know anything about labs and like they need to do something tomorrow, definitely start with like general nutrition guidelines. I can tell you that 95% of the population is not doing that.
Right.
Like, how do we eat clean? What does that look like? How do I read an ingredient label? What's a carb, a protein, a fat? Those are like simple things that we go over. How to do ingredient swaps. So instead of like your whole wheat flour, you can do your almond or your coconut. Instead of, you know, dairy, you can do almond, coconut milk, cashew, hemp, whatever.
Yeah.
Just simple things.
I definitely don't see a shortage on like healthy foods anytime soon. You know, like those are going to be okay. They might be out of luck on toilet paper, but they should be good on almond flour or something. What was the other thing I was going to say? Oh shit, I just lost it. So the program that you're working on right now, tell me a little bit more about that and how that can, you know, help offices, not just in this situation, but long term, especially because I think this thing could go on potentially for 12 to 18 months. Like, it won't be like nonstop lockdown, but it might be like a cycling, like 1 month, one month on, 1 month off kind of thing. Yeah. And they're going to have to get a more stable way of providing service. So tell me a little bit about the program. And I was brainstorming some ideas, and I came up in terms of name, because I know you haven't named it yet. And I came up with functional telemedicine for dummies.
Yeah.
That really like resonates with me, because it makes me realize this is for somebody who knows nothing.
Yeah. And it basically is, that's the way I built it. The doctor that kind of pushed me to start it in the spring, or last spring, I guess, he's like, pretend like I don't know anything. So that's where we start. We start with, okay, this is like your CBC panel, and this is what it means. And we talk about like in medicine, or when you look at labs, they have ranges that are out to here. Yeah. And like, they're looking at death and dying if you're outside of here, or something we can call. I don't want to work there. Like, we focus on those perfect functional ranges where, you know, body's perfect, because ideally that's where we should be. Yeah. So we can see things and like pull pre-diabetes back before we watch it get to diabetes, and oh, now you need, you know, metformin, insulin, whatever they need. So we start like from the beginning, going through body systems, from adrenal to thyroid to GI markers. Like, this is where it should be. This is what it may say on a lab. This is what it means. Yeah. And then I put like supplement recommendations for those people that don't know anything, or like, I just need something to get started. So in this case, this is good to use. And I go from 3 different companies so that they can kind of pick. The good thing is they have a lot of like virtual dispensaries now. So you don't have to carry a single supplement in your office. And in this case, you know, it doesn't matter if you do. Yeah. But you can kind of send them what they call a prescription for supplements. Patients go on an order, you get an email saying so-and-so spent $200 and got these, and then they can go and reorder them, which is super nice. Yeah. And then we go through like, these are patient forms. So here's your consent to treat. Here's your like intake. These are the questions that you ask during the discovery call. This is how you do follow-up. This is scripting for labs. So instead of like using all these technical terms and your alkaline phosphatase is high, meaning this, it's, you know, this is low and you need some zinc. basically, like how you talk to the patients. And then we go over, I have like every PowerPoint presentation I've ever done on there. So if they want anything that's like made for them, I have one on type 3 diabetes, on sugar, on all the different talks I've done. So it's kind of done for you.
Yeah.
And then I offer one-on-one coaching to go through with 4 of their patients. For they can either sit back and watch, or I can do it for them, or they can do it in front of me. And then we go over the consults with the patients and the labs and the follow-up.
Nice.
That way they're kind of comfortable and they're not just trying it on their own.
Yeah. No, for me, it's like just the way that I like to buy things. I'm like, man, I just want to make sure that I'm doing things the right way instead of just like assuming that I am. I would much rather like the teacher like look over my shoulder as I'm like screwing it up. So like,
and that's been really helpful. Like just for them to be like, am I doing it right?
Yeah, exactly. All right. Are there any other general tips in terms of other than what we've talked about that'll make it possible to where people could get up? And I mean, these things, the things that we've talked about today are things you could get up and going within 24 hours. Like it's not like this is like some like 2-week buildup thing.
Yeah. And two, like it doesn't have to be hard in the beginning. Start with your patients and talk to them and say, hey, I'm, everyone goes to the doctor, I'll look at your blood work in a different way. And that's a lot of kickback that like in your head, you'll get from the beginning. Well, I just had my blood done. Great. Let's look at it, because I look at it from a different perspective, and I'm not looking for disease, but I'm looking where things are starting to go awry.
Right.
So we can fix them before it's a problem. And they're happy to do it. And then you show them side by side, this is what they're looking at, but this is what's really going on. And this is how to fix it. And it's simple. And I have patients, and I've checked their blood every 6 months since we've gotten it to normal for years. And they don't go to the doctor anymore unless, their arm's falling off.
Yeah. I actually, I think this is the question I was trying to think of earlier. Let's say I am a patient and I'm like, Jamie, I am freaking out about this. I don't want to get sick. And if I do get sick, I don't want the severe looks really bad. What can, like, I'll do whatever you say. What would be the things that you would be focusing on right now? Like what systems would you be looking at, or would it all just depend on what their blood work looked like?
Systems as far as body systems?
Yeah. Like, would you look first at like adrenals, or first at inflammation, or like, what would you think?
A CBC with differential. So to look at the different parts of their white blood cells and looking at them from a functional view, because you can tell if there's like a low grade infection or if it's ramped up higher. Yeah. And then checking their D is huge, because we want to make sure that, because medically they want it over 30, but they've still shown, immune suppression, anxiety, depression when it's that low. Mm-hmm. But if you get it over 60 or 70, that's where you're golden. So that difference is huge. And then a CBC will tell you if there's inflammation in the gut, which we know that affects immune system too. Mm-hmm. And then, adrenals are probably secondary.
I just made that up. I don't want you to.
Well, I mean, it's if your body's under stress for a long amount of time, that's going to affect immune system. But like basic labs that you can get ran at wherever, those are the 2 I'd look at now.
Are there any like gut specific tests? Because, everybody I've talked to has talked specifically about like, you got to have a healthy gut, Yeah. So what would you be testing there?
Well, I do a stool test if I'm looking at gut, like with a serious issue. So it'll tell me if there's viruses, bacteria, what your enzymes look like in there. Blood wise, you can tell on like your proteins. So on your comprehensive metabolic, you can tell if there's like hypochlorhydria, not enough stomach acids being produced. Yeah. And then looking at white blood cells with that fine tooth comb, it'll tell if there's like parasites, if there's tissue destruction, inflammation, what's going on.
Gotcha. All right. Well, this is why we bring you on, because you know all this stuff. So, so if anybody wants to find out about functional telemedicine for dummies, where would they find out more, or should they just email you like I told them to earlier?
They can email me or message me, or I think it's integratedfunctionalmedicine.𝗀𝗍𝗀.com.
integratedfunctionalmedicine.𝗀𝗍𝗀, which is KAJABI.com.
Yes.
We need to get you a better URL to
forward
to.
I know
Let's see if that
My
functional
nephew.
telemedicine for dummies is available.
Yeah.
I'm sure it is.
Yeah.
All right, Jamie, anything else that we didn't touch on? Any inspirational words you want to leave the people with?
I don't think so, but just don't be scared. Like if you need some motivation, Grant Cardone like hit it big during the 2008 crash. So he wrote a book, The 10X Rule, for that. And I've started listening to it again just to like keep my head out of the craziness and turn off the news.
Right. Turn off the news is key. That's for sure. That's that's the thing I keep telling myself every day. I'm just like, just get to work. Like you are not going to control anything that happens with the state or the federal government. Just work, Yeah. All right. Well, hey, Jamie, I appreciate it. I know that people will find this information valuable. If you want to email her for the consent form, it is Dr. Jami West, DrJamiWest@gmail.com. And then the URL was integrated functional medicine.𝗀𝗲𝗀.com. We will, I think I got all that right?
You did.
Okay, good. Perfect. All right, Jamie, I really appreciate it. And we will be looking for another expert to bring to you guys tomorrow. We'll talk to you next time.